the first B20 G20 Dialogue organized by Confindustria in the framework of the Italian B20 cycle. As the time demanded, and for the first time in the B20 history, we have decided to have a task force fully dedicated to the sectors of health and life and science. More than ever, this year has taught us that protecting our health also means protecting our economy, our culture, our history, relationship, and our well-being. This is why scientific research is key, and we need to act so that its benefits are shared inclusively. I want to stress these three words: include, share, and act.
These are challenging times. The global community is combating a worldwide pandemic which has affected the lives of each and every one of us. States need to regain a leading role in supporting research and development of new drugs, vaccines, and diagnostic. They need to promote value-adding innovations, taking into account the public health care perspective and the research community viewpoint. This is one of the key issues of the policy paper that Task Force will submit to G20 leaders. The pandemic has shown that without health, there is neither economy or social progress. This is the guiding principle of the government action in such as a difficult situation.
I couldn't agree more with the topics that you mentioned, in particular when it comes to the massive damage that the pandemic has done, and at the same time also the great opportunity that we see in innovation and in particular in healthcare as a strategic asset, because we can no longer take health and healthcare for granted the way we may have looked at it before the pandemic. With that, it's also clear that innovation is absolutely key in order to change the things for the better, which we have seen, I think, dramatically with the very, very quick development of the vaccines. These are only two examples for what we think is the beginning of a new era, and that is the era of the bio-revolution. It is the convergence of biology and artificial intelligence with new technologies such as CRISPR, or actually your stem cell therapies that will make huge contributions towards your better healthcare and towards the potential to substantially better treat or even cure disease.
That we take this work very seriously, and we recognize the growing pressure for G20 members to address outcomes and access more than ever before, while at the same time reducing the overall cost of care. Now, these goals may seem diametrically opposed, but I truly believe that all three of these goals can be accomplished by unleashing the power of technology and innovation. And there's no better time than now. We're entering a golden age of technology. Healthcare and technology are converging, and the boom of innovation we will experience in the next 10 years is greater than the past 100 years combined. I know that sometimes when industry says innovation, health officials think expensive technology. I think it's important to bridge these perspectives. Investing in innovation can have a profound impact on health outcomes, as well as provide an economic benefit for your countries, making healthcare actually an economic driver rather than a cost burden. Innovation and technology will help patients be healthier longer out of the hospital and contributing to society. This includes self-management and disease prevention, like with obesity and diabetes, as well as better and earlier diagnosis, like with colon cancer or heart disease. And when acute care is needed, innovation can unlock more effective and less invasive treatments and fast recover, such as with robotics and other digitally enabled technologies.
We sit at the cusp of a choice. We can switch the light off and go back to the way we used to do things, or we can keep that light on and continue to accelerate it. Before you, the recommendations for consideration of the B20 are how we keep that light switched on and make sure that we realize for the whole of humanity the opportunities from the digital biorevolution. So this is important because we now know that patients and public through the pandemic have solidly embraced technology as a route to information. They are using devices like this to communicate via the Zoe app. 4.6 million UK citizens, every day they enter their symptoms, whether they've got long COVID or COVID, and this is amassed substantial data from which a group of scientists have been able to catalogue early in the disease the symptomatology, and also to understand the architecture of a new phenomenon for the planet, which is long COVID, persistent symptoms after 3 months, which may be very debilitating and may be an ongoing health problem for years.
Pharmaceutical device diagnostics and data, all these technology. So the way we capitalize this new era of innovation is actually through collaboration. Not only pharma collaborate with device and diagnostics and digital, and also healthcare institution, and also cross-country and public collaboration with private, and private collaboration with private. So there is no limitation on the border. So we believe we can be successful if we can really work on the following areas.
What can be defined from my side as a sort of cultural hybridization. In simple words, we observe the combination of the traditional healthcare environment and the new technologies, and this combination probably is driving the change and offering an opportunity to completely reimagine our current approach to cure. And what is going to be more impacted by this new tendency is the way we bring innovation to patients.
So every dollar invested in research and development, for example, generates an additional $2 to the broader GDP beyond health. And there are spillover effects because we're investing in development of capabilities, know-how, and human capital. So every 2 new employees in the health economy generates an additional 1 new employment in other sectors, and every new employee in research and development generates 5 new employees in other sectors. And beyond these, we have the health system benefits of improved health, investing in health systems to improve health, which leads to improvements in economy through improvements in human capital and economic returns. So every dollar invested in health, according to a number of studies we've done recently, generates economic returns of $3 to $30.
First of all, on behalf of the government of Indonesia, allow me to express our sincere gratitude to the B20 Italy for organizing this important dialogue. During my 50 years of life, I've seen how technology changed the music industry. I don't know whether technology will change the health industry as fast as they did in the music industry, but from the trend, I do believe some major changes will happen. So in Indonesia, what we are doing now is we are very keen to make sure that our information database about our patient will be centralized on the patients. If I go to a hospitals and being measured or being examined, the data is owned by the hospitals and it will be owned by myself. If then I go to a lab in a different city, again, the data will be owned by that particular lab and also by myself. If I apply or I buy a Garmin watch and connect my daily activity data to Garmin, I wish I can establish a regulation that the data, while it's owned by Garmin, is also owned by the customers. So if something happened to me and the medical professionals is granted the access to all of my data, they can get it from everywhere, as long as it's my personal data. As a 13 years bankers, I realized that this industry is actually quite interesting because most of the country that I observe, the health cost growth in the last 20 years always bigger than GDP growth of that particular country. And as banker, I can say it is not sustainable. It is our responsibility to prepare our children, the children of our children, the future generation of human beings to be much more prepared than us. Everyone is safe, and wish you all the best for the B20 and G20 meeting. Hopefully, we can work together and overcome this pandemic.
It's the first time that I heard from Minister Speranza, executive of our government, of course, speaking about a vision integrating the future with the best cooperation possible between private and public and among different countries, with a total cooperation, as perfectly stated the Indonesian Minister of Health just a few minutes ago.